Dr. Eneyni, can one use over-the-counter medications for migraines?
Well, sure. There's no harm of using that at all. As a matter of fact, it's quite reasonable at the beginning of treatment of migraine for people to take over-the-counter medicines. They do have to look at the bottles that they're using and read the instructions very carefully. Also, they should be very careful of not using more than is prescribed, because in addition to liver and kidney damage, they can run themselves the risks of rebound headaches or so-called chronic daily headache.
Okay. And what about prescription medications?
Prescription medicines would be the next step up if the over-the-counter medicines do not work. There are many medicines that one can use. The most common form of medicine out there is called a triptan. A common one we use is called sumatriptan or Imitrex. And the advantage of that particular agent is that it's available in an injectable format, in a nasal spray, and also in a tablet format. So it's convenient for patients who have a lot of nausea and vomiting, in which case they would want to avoid tablets as they're likely to vomit these tablets. And there are other agents out there. There's one called Maxalt and one called Zomig. These are two brand name. The first one, the rizatriptan or Maxalt, is also available in wafer format. So patients who tend to be nauseous or who do not have access to water can actually use that wafer without water. It's a candy that melts on the tongue. So patients who are getting headaches in the movies or in the airplane and don't have access to water can just jump in and take that candy. And Zolmitriptan or Zomig also comes in a candy format. Now they have to be very careful because some of these medicines interact with other medicines that they may be on. For example, propranolol can actually increase the levels of that rizatriptan, and their doctor is going to have to lower the dose of the rizatriptan. There are other interactions, especially with antidepressants and antibiotics.
Okay. What about Furoset? I've heard a lot about that.
Furoset is a common medicine. In the past, it used to be as first-line treatment. It is no longer recommended to be first-line treatment. These are called combination medicines, and it's comprised of Tylenol or acetaminophen and a sedative and another agent. They are nowadays used only as rescue treatment. They are a last resort. They should not be used as first-line anymore.
Okay.
So if these medicines do not work, the next step would be to go on possibly a preventive medicines, and perhaps with our next meeting we can talk about that.
Sounds great.
So make sure everybody follows us on our website at angelsneuro.com or on Facebook under Angels Neuro, and also through this channel, YouTube, and we'll be back chatting about that next time.
Sounds great.